Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
That's me.
So you fell, and where did you land it? Like, did you hit your shoulder? You
Yes,
hit your
this
head?
side.
So you landed this way. Did you have bruises or something like that?
Yes.
So where did you have the bruises?
My
You had bruises in your
Face,
face,
Then hands.
your hands.
And
here,
Did you land this way,
I think so, yeah.
like,
This maybe, this one.
or you landed on your elbow? And that was November 2020. We are in March,
It was in
so it's
March.
5 months ago.
March.
Okay. So when you landed there, did you lose conscious?
Yes.
Okay.
I don't remember anything.
You
I
don't
don't
remember
remember.
anything.
Yeah.
Okay. And what kind of treatment you had for that after that?
This for acupuncture.
So you had acupuncture. Did you
Yeah.
go to the emergency room or
Yes.
something like that?
Yes.
They did X-ray or
X-ray and
everything was okay?
Yeah.
Did she
they
tell you
got a
anything?
whole, they even did like a drug test.
Oh, okay.
So, they worried she have some.
She lost conscious from something.
Because-
Yeah. Okay.
So it comes out, everything come out okay.
All right. So you had acupuncture. Did you have massage or any other treatment? So you had massage too.
I
Okay.
still has pain.
How much pain from 0 to 10? 10 is emergency room.
It's 3, 4.
Is that constant? 3 or 4?
Both sides.
So which side do you want to focus on now?
Both.
Both? Okay. We'll start with one and we'll work on the other one. Okay. I have only 2 hands, but I can work on one side at a time.
We'll leave tomorrow, so.
Yeah. So, yeah, because we start taking the history for the left, we'll start with that and then we're going to work on the other side. Okay.
This is this pain is 20 years. 20?
20 years?
More than 50.
The
15 years. Yeah.
15
yeah.
years, the
After surgery.
right shoulder
After
pain,
surgery.
15 years.
So she fell 15 years ago?
Yeah.
No.
When was the fall?
She fell 5 months ago on the left side, and she had issue with the right side, and that was painful for 15 years, and had surgery on the right side. Okay.
Okay.
So, all right. So let's focus on this. We'll work on this, and then we'll jump to the other side. So, what is difficult for you to do with the left arm? Can you lift your arm up?
Pain.
Okay, so
Okay.
you can stand up facing this way. So as you see here, the limited range of motion, she does not have a full range of motion. Let's go forward like this and up. That's limited. You feel pain here. Okay, can you bring your arm back? Back is okay, all right.
This one.
Oh, that is tight. That's the side that she had surgery on. Let's turn around. We're gonna do both at the same time. Turn facing this way. Let's face this way. So you see the difference? This is the side that she had the surgery on. That's 15 years of limited range of motion. And you had the surgery 15 years ago?
Yes.
Okay, so she has more limitation here, but you have more pain on the left or the right, or both are bad?
Right
More
side.
pain on the
Yes.
right side. Okay, we're gonna work on both at the same time. Okay, so let's face me. So I want you to lift both arm up and let me know how much pain you feel.
Here.
How much?
Oh.
Both of them?
Yes.
How much from 0 to 10?
Three.
Three? Okay, thumb up and bring it this way. How much pain?
Same.
6?
Three.
3? Can you do this?
Same.
Same. Okay, have your arms straight. Okay, that's painful. Don't let me move you. Don't let me move you. Do you feel any pain with that? It's all on the bottom? Okay, she's very weak actually. Don't let me move you. Very weak. Okay. Right, have your arms straight like this. Like here. Don't let me move you. Oh, yeah, you're really weak. Somehow down. Did you feel more pain with what I'm doing? Yes, no?
Pain, yeah, here.
Right shoulder flexion, I'm gonna take the measurement here. And right shoulder flexion, straight your arm up like this. So right shoulder flexion is, I don't know if you can see it here. This is, it's kind of like 160. Right shoulder flexion 160. We're gonna compare the numbers, okay? So we're gonna do right shoulder abduction. And right shoulder abduction, that's very limited here. I don't know if you can see it, but you cannot see it. I will show it to you after I take the measure. This is 140. Abduction is 140. Are you writing, Lindsay?
Yes.
Okay. So we're gonna do right shoulder internal rotation. It's okay, but it's still limited. Internal rotation here is 60. Okay. External rotation is normal. External rotation is like 90, almost 90. So external rotation is normal. Everything else is limited. Okay. While we're here, you have your head on the other side. We're gonna do the left side because we're gonna work on both of them actually. So head here, yep. And we're gonna compare between left and right. Okay, scoot down a little bit. So left shoulder flexion. Okay, straight your elbow. Okay, left shoulder flexion is 148, okay? Flexion 148, that's a left shoulder. Left shoulder abduction, bring it up toward your ear. And that is 160. 160 abduction on the left shoulder. So we'll test the internal rotation, let's see. Internal rotation is normal, like 90, okay? External rotation is normal here. Okay, so while you're here, actually we'll work on this. You told me you had a neck surgery. Yeah.
Oh, neck surgery.
Okay, let's turn it all the way toward me, your head. Let me know if you feel pain the other way. Remember how far you can look, okay? Extend your neck back. You're very stiff actually in your neck. Down. That is very tight. So did they do fusion in your neck?
Yes.
Yes.
What level?
Long time.
How long has this been going on?
20,
20 years?
25.
25 years you had the
No,
neck surgery.
2003 she had.
Okay. So any pain in your neck when you do this motion? Very stiff. Okay, because she has a history of neck surgery, I'm gonna actually work on the neck. Because any fascia restriction or any scar tissue here, because the fascia is connected to the entire body, it's gonna limit the range of motion in the shoulder, directly and indirectly. So let's move your neck left and right. Remember how far you can see. So that's very limited. That's very limited. And the other side is limited. Extend your neck backward, go backward, and very stiff and down. And let's do side side bend, left and right. And the other side. Do you feel pain in your neck?
It's not pain, yes.
It's just a stiff,
Yes.
tight. And where do you feel the stiffness? In the back or the front? In the back. Okay, is it okay to work numbness and tingling in your hand?
The reason she had the surgery was she had a constant headache, and then took the MRI and she had
How's your headache?
I think it's okay.
headache gone for after surgery headache is gone, but downside is
You had a lot of issue with the neck, and did the shoulder happen afterward?
yes.
Oh, okay. All right. And I can see the scar here to the surgery. You had a lot of surgery. Let's scoot down a little bit.
From the medical.
Okay. Relax. Okay. So I'm actually trying to release the fascia with my hand here in her neck. And I can feel there is a scar tissue and fascia restriction, so I'm gonna go deep actually. Oh, don't worry, don't say out, okay? Just a smile on the camera. Let me know if that's painful, okay? How does that feel? It's okay, alright. So because the superficial fascia layer, it's like a wrap surrounding the entire body. So it's a very thin layer under the skin that's wrapping everything. So when you have tightness in the fascia layer, it's like you're wearing a t-shirt 2 to 3 size too small. So it compresses on everything. So really we cannot separate the neck from the shoulder when we talking about fascia, because it's like a Spider-Man suit. You really, there's no end or beginning. It's a continuous system, you know? So when you start to have like a scar, like surgery or any trauma in certain part of the fascia or the body, that make that part very tight and like this. So it limited the range of motion, and it does not give you enough room for the shoulder to move. That's why I like to work on the neck area, because a lot of the time restriction from fascia restriction or scar tissue, and then make sure it's not painful. Is it painful or it's okay? Sorry. Sorry. We already can see the restriction in her neck, and so at least if we can get more range of motion in her neck, we'll see actually her range. We're gonna measure her range of motion in both shoulders and see how she responds to the treatment. Okay, how does that feel? Good, okay. Is that painful? It's okay. So I definitely can feel the scar tissue in this area. You guys, like, did they do like what they do, like C5, 6 or something like that? Yeah, 2 levels or more?
I think 1.
1 level? Okay. All right. So I can feel the scar tissue in here. Okay. And it's right on the surgery here. And I'm on this side.
Dr. Jacobs, how much pressure are you using with that tool? It doesn't look like you're using.
Because the location, this is very light pressure.
Can you talk about that when you're?
So when you use like, so rule of thumb, I do really very firm pressure. But when I start to work on something like in the neck area, I'm very gentle because there's a lot of other structure there. So, so if I'm gonna do it here, I'm gonna be more firmer than here, because you have a lot of like arteries here and nerve and a lot of sensitive areas. So I'm actually very gentle initially, and then when I get on the muscle like the SCM here and the scalings, I try to go deeper. So it's based on the anatomy, but most likely for the muscle, I'm trying to be firm so I can go deep. Is that too much or it's okay? Is that too much or it's okay? Okay. She's relaxing, that's a good sign. And I can feel the scar tissue from the tool that it's rolling over like a kind of small rocks in this area. Can you feel those? Yeah, okay. Yeah, it's very obvious for a patient to feel it with the tool. And I feel it here, like I feel like I'm going over a rock, not smooth surfaces. And also, I get vibration from the tool that I usually don't get it from the, if there is no scar tissue. So I released some of the scar tissue here, okay? And I actually, because she will not tolerate to go deep, so let's try to go deep again now and see if she can tolerate, so I can do deep release for the fascia and the scar tissue, okay?
So when people are doing the home treatment and can you explain how you how they should do that sequence then, if it's too
So,
sensitive or
The
too
people in
inflamed?
the home treatment, we have the home treatment program, and I go into that in detail.
Mm-hmm.
And I have a model, she was working on herself, and I explain how much pressure and how you do.
But like before you used the A5, but she couldn't tolerate it, so what do they do? Like you went to the next tool?
So yeah, I used well, you can use the A3 or A4 to break the scar tissue very gently.
Mm-hmm.
And in home treatment, I showed them manually how they can release the fascia if it's too sensitive to use the tool to release the fascia.
Mm-hmm.
Because now I'm going deep inside. I don't know if you can see it. It's actually at least the whole black rubber is inside and over that. So I'm actually going deep, like 3/4 inch.
So this would be the tool that, of all the tools, the A5 is the one that they'll probably be the most sensitive to if they have inflammation.
If you have inflammation and if you have tightness.
Mm-hmm.
But now she's not really, she's doing fine
Mm-hmm.
because I released the superficial fascia layer. So when the superficial fascia layer is tight, it's gonna look like this, very tight. It's not gonna allow the A5 to go deep in.
Mm-hmm.
So I release the superficial fascia layer, so this is very loose. So when I use the A5, it can go deep in. But if it's pulling like this, it will prevent it from going in.
Mm-hmm.
Does that make sense? The answer is yes.
Yep.
Okay. All right, so I'm gonna go deeper here. How's that? Okay. All right. And when you have tightness in the front here, it's gonna be like pulling the whole neck forward. It will prevent the full range of motion. Sorry. Okay. All right. So while we're here, let me do some work on this shoulder. How does that feel? This is the one she had the shoulder surgery. Why she had shoulder surgery here? Did she have the rotator cuff tear or they just cleaning?
Had the rotator cuff and
Partial or full tear?
partial.
Partial rotator cuff tear. What else did they do?
She was in a lot of pain, so
She was not?
she was in a lot of pain.
Okay. So you had a tear here, so they worked on a tear. Okay.
But pain never went away,
Oh, okay. So,
shoulder surgery, you try to, a little pain, but after surgery.
the pain is the same? Yeah. Well,
Not as severe, but still a lot of pain.
Well, from a patient perspective, you probably don't care about the tear, you care more about the pain. I don't care you fix the tear, but what I care, I don't want to feel the pain. But if you fix the tear and I'm still feeling the pain, you might have something else going on, So we're gonna work on that. Can we get some water for her, please?
Mm-hmm.
So I'm actually going deep, like an inch deep actually with the A5. That's why one of the common questions, I can release the scar tissue or the fascia with my fingers, my hand. The answer is no, it's impossible because mechanically with my finger, I cannot go as deep as the A5. With some patient, in some areas, we can go deep even like 2 to 2.5 inches or 3 inches deep. With your finger, you cannot impossibly because it's very thick, and actually your finger can hurt you doing that. So some therapists, they teach some techniques to use the knuckle. I'm like, that's even thicker than this, and it's actually more painful to do that and apply some pressure. And other therapist technique, they teach to use the elbow. I'm like, that's impossible actually to go deep because look at the thickness. Mechanically impossible to go deep with the elbow. And guess what? It's so painful with the elbow. That's a bone, So this rubber, it actually have some give, so it's more comfortable than using the bone on the patient. How's that feel? I'm really going deep. I'm going about like 1.5 inches here. And I feel another scar tissue here, fascial restrictions. How's that feel? Sorry, what about now? So she felt a little bit pain, so I decreased the pressure a little bit. It's still going deep, but not as deep as she's tolerating that depth. Okay. And then when she's doing better, I'm actually going deeper. How's that feel?
Okay.
All right. So I'm gonna do the same thing on the other side. Sorry. Okay. So she's actually more sensitive on the right side in general, and that's the one with the chronic shoulder pain and the surgery. So again, I use the Magna Heal, but not now. I want to see how much we gained from working on the proliferation stage, which is the stage we work, the stage of the scar tissue and the fascial restrictions. And then we're gonna work on the inflammation if she needs. But I want to see how much pain is related to the inflammation that she might have. She definitely has some inflammation, but we don't know how much until we reassess. Okay, sit up for me. We'll have you drink some. Let's move your neck now, turn left and right, and tell me how that feel. Can you tell the difference?
That's
That's
better.
range of motion more.
Yeah.
That's more. Let's extend back. Did anyone, yeah, of course you had physical therapy, yeah? After the treatment, you had like, what other treatment you had for your neck? Massage,
Massage therapy,
physical therapy, massage therapy,
can work for
chiropractor, okay. Did anyone work on the front of your neck? Because it's prohibited. Okay, I'm just joking. Okay, so let's move it again, left and right.
stay here.
Okay, just move your neck only. Okay, extend your neck. You see the speed of movement? She move a lot faster. Smoother movement, it's not very stiff. Go back, extend. See how far she's going, can extend now. She was not able to do that. Can you tell the difference? And she actually going back and forth, so that means she's feeling better. So let's do side bend, left and right. Okay, that's much smoother. Okay, so how your neck feel now?
Yeah, it's okay, so good.
You feel looser?
Yes.
Okay, let's both arms. I want to see if working on the neck, I worked on the shoulder a little bit, made any difference. So extend, going back. How's that feel?
Yeah.
So we're gonna work on the back, but
No.
we wanna see how is your shoulder feel, and let's do thumb up here and bring it up to your ear. How's it feel?
Yeah,
Better? Okay.
but still pain.
I did not work on this area.
Is this muscle?
There's muscle everywhere. Yeah, we're gonna work on that. Let's turn around, and I wanna see how far you can go back this way. Bring it to your brow. Okay. All right. So turn around. So your pain now in your shoulder here in this areas. Okay. So let's right here. Yeah. I can feel a big knot here, very thick knot, right in here. Too much? Okay. So a little bit of scar tissue in her, triceps and biceps, but most of her scar tissue, that's a big one here. Okay. Just want to loosen this up. I'm gonna actually use the A5 after this. Sorry, is that sensitive? We did not use the Magna Heal yet. I'm probably gonna use that. Sorry. Okay. And here sensitive too? Okay. Let me see if I can do something else to increase the sensitivity. Okay. Is that too much or it's okay? do the same thing now. So it's hard to see it from this angle, but I'm doing the exact same thing. Is it too much the same thing? Yes or no? Is it as sensitive as the other side or no?
I think the skin of the
What in here? There's a knot here? Sorry. Here, that's a very thick scar tissue.
Dr. Jacobs, can you imagine if they were doing stainless steel, like breaking
Tools?
it down
Yeah.
on her?
Yeah, that was one of my prototype that I had to throw in the trash. Because it's extremely painful. It's ergonomically not designed. It's just sharp on the body, you know. Yeah, that's why I don't like the stainless steel tool. Because there's a lot of disadvantage of using the stainless steel tool. And you can see a lot of videos for patients have this treatment, a lot of bruising, and you can see some of those videos actually they did not mute the video. You can hear the screaming of the patient. I'm like, are you torturing the patient? Oh, so you torture the patient to break the knot. And what the benefit of breaking the knot, and it's actually causing another trauma, causing more knots. And putting in the patient in more pain than what they came for, which is really not the best approach. So she's very inflamed here. Let's get the magna heel from your back and we're gonna put it here to use it.
Is it still in your back?
Okay, still have it. Still have it, okay. So this is a magna heel tool. I'm just took it off the belt that comes with it, just for me. I can use it here in the clinic, work quickly, because she has a lot of inflammation in this area. She's not tolerating the tool, so I'm jumping to the inflammation protocol. And part of the inflammation protocol is anti-inflammatory diet. And I go over that in the patient programs. And we start with her with some supplements for inflammation, and based on the nutrition evaluation we did yesterday, there's signs of several deficiency of vitamins and minerals. So we start to work on that to optimize the body normal healing cycle. Because if you have, like, for example, if you have deficiency in magnesium or C or D, you need those for your body to heal, to move from an inflammation stage to proliferation stage to maturation stage, which is the 3 stages of normal healing. So magna heel is going to work very well when you don't have deficiency. When you have magnesium deficiency, this is not going to replace magnesium. We need magnesium, that's example. Or C deficiency, we have to have C. So that's why we have to do the nutrition function evaluation to figure out what is missing in the body that impair healing or prevent healing. So when we use the tools, the body will respond fast. How does that feel?
Okay.
Yeah, so this is very strong magnet. I stuck in my car, as I said before, because of that magnet. I had it in my arm. So it's really strong. How does it feel? So that's where she has a knot. So she has really 2 big knots. Well, at least one in here, and on the other side she has both the same thing. And that's what limited the range of motion of flexion, abduction. And that's actually where she feels most of her pain when she moves her arm, because that muscle, so normal muscle should contract and relax like this, like a rubber band. So when you have a knot, it's like you have a knot in a rubber band, or you have a scar in a rubber band. So when your muscle contracts, it's not going to stretch much. It's going to prevent full range of motion, and that's what we see in this case, and most of the cases with limited range of motion. So no pain on the top here, it's just all in here. Is that correct? And this side too, is that correct? And the top here where you had the surgery? Okay, let's do work on that.
How many of these sessions, Dr. Jacobs, would a home treatment patient need to do for after surgery, like for her case?
It depends on how much inflammation and it depends on the deficiency. So if your body's stuck in the proliferation stage and you don't have a lot of inflammation, usually few sessions, max 1 to 2 weeks. If you have inflammation, that could take it a little bit longer. That's why we include the option for MagnaHeal 2 to start to wear it as soon as possible to decrease the inflammation. If there's no vitamins and mineral deficiency, it should be a few weeks.
So for a patient like her, how bad would you say
Yes.
her inflammation is?
Well,
Is she
because
severe?
we're dealing with a lot of things, like there's GI issue, there's cholesterol, high blood pressure, there's several vitamins and mineral deficiency and hormone imbalance. So we have to work on all this imbalance simultaneously because you need a perfect hormone balance, you need a perfect mineral balance, vitamin balance, so the body will do what it's supposed to do. The more deficiency you have, the longer the time it will take to really get the body to the optimal level. But we cannot pick and choose, okay, I'm gonna use the tools only, but I'm not gonna take the vitamins. I'm like, well, you need the C, the D to help you to heal. So each person is a different, but the more complex the condition, the more things we need to fix. It's like you have a plumbing issue, but the plumbing issue is you have 5 holes. You cannot choose 2 holes to fix and expect that the plumbing in your bathroom is totally fixed. You have to really fix all the holes, otherwise it's not a full fixing. So that's how we know how long it's gonna take to recover or to get to the best level of outcome. How does that feel? I know she liked the MagnaHeal yesterday. She wanted to leave with it.
And she did.
She did. We took it from her by the door. No, it's, I personally have it with me in my bag everywhere I go because that's my first thing when I have any inflammation, any pain. I start wearing the MagnaHeal, get the inflammation down under control, and then use the other tools. Okay, sit up. And we'll have you drink a little. Let's, we're gonna do all the movement now. Let's move your head first, left and right. She's still maintaining the range of motion, extend back. Good, and forward. Okay, and side bend, left and right. Good, she's moving. She's still maintaining the range of motion and fast. Okay, let's move your arm up. How's that?
Yeah. Okay.
Okay.
Good.
Good, thumb up, and bring it up to your ear. How's that? You see? That's actually more range of motion here. She actually was able to go to her head. It's right in here, you feel it? Okay. So I usually like to do some experiment here to see how bad is the inflammation. I will put this here and do the range of motion and tell me if you still feel it or not. Let's go up. How's that?
Yeah.
Pain or no?
No.
So when we do the range of motion, okay, we need to use 2 MagnaHeal.
Referred pain.
One with each side. So this is another way of assessing the inflammation level. So it was painful before using the MagnaHeal. I put the MagnaHeal and had the patient do the range of motion. If the pain gone, that means the inflammation is moderate to severe, and the patient need to wear the MagnaHeal throughout the day or at night. So let's lower this down. Okay. I'm gonna put the MagnaHeal on the other side and we'll see how she's doing. So the pain was up or down? In here? Okay, so let's do the range of motion. Don't hit my face. Go ahead. Up toward your ear. How is that here?
Yeah.
No pain?
No.
Okay, so she needs 2 MagnaHeal, one on each side. So that's a sign of going back to the other side. That's funny.
What is this?
Yeah, you have a lot of inflammation. What about now?
Yeah.
This is fine?
Yeah.
What about the other side?
Yeah, a little better.
Yeah, so she definitely need the MagnaHeal and alternate between side to side. Remember, this is what, 20 years or
Yeah.
how many years?
Right side is about almost 20 years.
20 years, you can relax. Right side, 20 years of like pain, chronic pain with, and having surgery. And so that's an indication of severe inflammation. Let's take your range of motion. So I will have you lie on your back and Lindsay will get a complete
Mhm.
number. So you're gonna let me know the baseline. We're gonna start with, because you're here, we're gonna start with the left side. Okay, lift your head up, lie down, relax. It's cold or high? No, let me lift it up. Okay, let me lift it up. Just relax. Okay, so what did we have for the left shoulder flexion?
You had, I love how you asked that prior to the, it was 148.
Did you write it?
Well, no, yes, I
I
was just,
usually remember the number if I did one side, but.
just for trust purposes for the people that are watching.
So, yeah, so
Shouldn't they know, like,
you should write it down then.
I did.
While you're watching.
I did
I'm
write
talking
it.
to the people watching. And here, okay, so flexion, how much it was in the left?
148.
Flexion was 148. Okay. Now we're gonna try the flexion again, okay? Okay, lift up, up.
It's gonna be
over.
less, it's gonna be more than 148.
Okay, now guess what? It was 148, now 176. Wow,
You crack me up.
it's almost
176.
78. 178. You have to take the number, so that's actually good. Abduction, how much it was?
160.
Abduction 160, so we're gonna do the abduction. That's on the left side, yeah?
Yes.
And guess what? We got 180 now, so 20 degrees. 180. Okay, internal external rotation?
90.
Oh, that's normal, Mike.
You had normal for both.
Okay, so let's flip over to the other side. Head here. Okay, so 180 is a normal range of motion. You okay? It's cold. Sorry, sorry. I know you don't like cold. Okay, don't worry, you're gonna warm it up with your body. But when you warm it up, we're gonna change the position to the other side. Okay, how much was the flexion here? On the right side?
160.
It was 160?
Mhm.
Flexion here, okay. Straight your elbow. So flexion was 160. We are here. Okay. 170. We get to 170 here. Okay, so 10 degrees, not too bad. Abduction, how much it was?
140.
Make sure you write all the
Aye.
second number, okay?
Mhm.
140. So that was very limited. Okay, let's do the abduction here. Okay, 140 now is 180.
Oh,
Okay, so 40 degrees. Internal rotation,
60.
60. So normal should be around 90. Okay, to put it down. Okay. So that was 60. Now is 1 second. Now it's almost 90. Yeah. What external rotation?
That was normal.
Okay, so that's still normal. Okay, so for me, we'll have you drink more water. So it's a little bit cold. Okay. So we're gonna retest her movement and see how she's doing now. So she gained like some range of motion, she gained 20 degrees, other range of motion, she gained 40 degrees. That's not too bad for 20 years of chronic shoulder pain with surgery that she had and still have the limited range of motion and the pain. And we know that she has a lot of inflammation because when I put the MagnaHeal, she starts to feel better. That's mean that she need to have more exposure to the MagnaHeal. So let's do a thumb up and bring it up all the way. You see the speed of movement? How would that feel?
It's okay. Good.
Good. Thumb up and bring it up to your ear. And she's actually touching her ear before she was not able to do that. Okay, let's do this. We'll have you stand up and we'll turn around and you try to touch your brow. It's okay. How's that? So this one actually was like by her genes. So it's almost closer together. That's actually a very good sign. And that's the right side that you had the surgery, or the left side? You worked on both.
Right side is surgery.
Right.
So the right side, after the surgery, she was even limited in the range of motion, and that's 20 years ago that she had the limitation, she had the pain, and she had the surgery. And she had acupuncture, she had massage, physical therapy for the, So we just worked on it for a few minutes now. This is like almost close. We're almost there. Let's see if I'm gonna put, where do you feel the tightness here? Front here or down? Here, okay, relax your arm. I'm gonna do an experiment here. I will leave the magnet heel now and see how far you can go. Let's go backward, the same position. Can you tell a difference?
Yeah.
She actually went a little bit further. I put the magnet heel there. That's really evidence of inflammation there. So when we use a magnet heel and decrease the inflammation quickly, she can gain more range of motion. That's a sign of moderate to severe inflammation. That's a case that she needs to wear the magnet heel several hours a day or even at night. She gained the range of motion immediately with the magnet heel too. Okay, awesome. You can turn around. So 20 years. Look at this, and she's still maintaining the range of motion without the magnet heel, but she will need to wear it because she has a lot of orthotic change, a lot of inflammation internally. And to decrease that 20 years of inflammation is going to take a little bit of time with the magnet heel. So you had surgery, you had acupuncture, chiropractor, massage, and then you have now hospital, hot spa.
Yeah.
Okay.
In a spa, take a,
Hot water,
Heat.
and roasting you. Well done. She was well done in the hot spa. Okay. Let's avoid that. So what do you think now about ASTR treatment after having all those? So what do you think about ASTR treatment?
Yeah, it's amazing.
Yeah, can you tell the difference now? Let's move again, everything, and the side and up, and backward and turn around.
Wow.
She's still maintaining.
That's awesome.
That's good, that's beautiful. Let's turn around, and because you had neck surgery, let's move your neck left and right. And the reason I'm really keep doing the range of motion, because it's just not one time that you get the range of motion. She's maintaining it. So let's go up, back. She's definitely going a lot further. Beautiful, side to side. All right, so how's your neck feel? How's your shoulder feel?
It's soft.
Looser?
Soft.
Soft? Okay, awesome. Yeah, we soften the skin too.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.